Becky. Becky Walker has been in the sector for almost as long as me, not quite as long as me, and has been a staunch provider of services, great HIA services, for the last 20 or 30 years. This year she's a winner of the Home Improvement Agency Healthy Housing Awards. She's always got a good eye for actually what is the right thing to do as a provider of housing-related support services. And it's very often will expand the statutory limitations of our work to include a much better response to some of the situations we find ourselves having to respond to. And today she will unpack some of that in relation to dementia. Becky.
Thank you very much. That's a very hard presentation to follow, the last one, but I'll try my best. So if you could go on to the next slide. I'm going to sound like Professor Whitty, I think. So this is just, oh, sorry, could we go back one? So this is just an introduction to our team. So I'm Becky Walker. I manage the Home Improvement Agency at Oxford City Council. We're a small district-based home improvement agency and part of the County Council Oxfordshire contract, but we're just in Oxford City. Obviously, Home Improvement Agency dedicated to help older and disabled people repair and adapt their houses as much as possible. And this is just a picture of our team. So there's me, we've got our 2 surveyors, a handy person, caseworker, an admin, and then we've got 2 in-house OTs that we actually fund directly. So we've got an adult OT and a child OT in our area as well. So go on to the next one. So as a lot of other agencies, we actually changed our RO policy as soon as I came in. Sorry, could we go back? So we used to be quite a small traditional HIA, but after speaking to our better care funds and our clients and our community groups and health partners, we developed this new RO to try and help as many people in our area as much as possible. So we took into all the ideas that people brought up, and these are all the different grants and things that are available. And picking up on one of Yasmin's points, it's very difficult to actually mention everybody in your RO policy, and everybody is different, as we've already mentioned, or a lot of speakers have mentioned. So one of the things I actually put in my policy in the discretionary DFG there is one sentence that says, any other solution to meet the needs of disabled people to be agreed with the head of service. So that's sort of a catch-all sentence that I've put in there, because no matter how well you write your RO policy, there will always be somebody that comes along that says, I have this need that you haven't thought of. And that's been a really, really useful thing to have in our policy, to be able to help a lot of people that perhaps fall through the nets. And then as we've been going along, we've then developed our policy to actually meet some of the things that we haven't had in there originally. So if we could go on to the next one. So these are some of the things that we do at the moment. So we've got a traditional DFG, or disabled facility grant. We've also got a known means tested grant, which is up to £8,000. And we've also developed a children's leaflet, that yellow one there, which is for disabled children and their families as well, just to explain how they can apply for grants and to make it a bit more accessible for them. So how disabled children and their family can access grants. We've got help for heating. So that's things like we give out temporary heating, warm packs, boiler servicing, boiler replacements, gas safety checks and repairs. And then we also come across an awful lot of vulnerable clients who have major repair issues. So we've got the repair grants, and the main 2 things that we have available is the flexible home improvement loan and an emergency repair grant. And last year we spent £392,000 on flexible home loans and 96 grand on essential repair grants. We've also got a small repair handy person service, which is a subsidised rate, £20 an hour. But if you're on low income and it's a safety issue, or it can help with energy efficiency, then some of that work can be done for free. So if we could go on to the next one. So part of the main things that we've got in our policy is a safe and secure grant. And that, as it says, it's specifically to enable homeowners to have quickly access money to help minor adaptations and small repairs to meet the aims of the Better Care Fund, so reduce accidents and allow people to get out of hospital quickly and stop them going into hospital in the first place. It's a small non-means tested grant up to £1,000, and we put that in our policy specifically to help. We go on to the next one. So I think Yasmin mentioned this. So we really heavily marketed our new Safe and Secure grant to all the hospitals and our health partners and all the different groups that we were working with. And we set up a very productive partnership with the JR Hospital, who actually allowed us to have a permanent stand in their hospital. And as you can see, we've actually plastered the entire hospital with all our leaflets and information, which has been really useful. So they're in all the lifts and where you book your taxi to go home and where you're waiting for a bus, and in the children's unit and the dementia unit and absolutely everywhere, so people can find that information. And we used to, obviously can't now, but we used to man the stand there and put it on the intranet so people could come and talk to us as well. But we will be back there as soon as we're able to do so. So go on to the next one. So since the pandemic, we undertook roughly 201 safe and secure grants, and the total cost was 69,000. So you can see the average cost of each job was only £346. So they're not massive interventions, they're quite small things, but they do make a huge difference in terms of people's safety. During the pandemic, we realised that there was an awful lot of people wanting to come out of the hospitals. And we were a bit worried that the Safe and Secure grant wouldn't be enough. So we applied for emergency change to our policy and actually increased that to £2,000. So it's still 2,000 at the moment, but it is a temporary change just to allow more people to come out of hospital and for us to do a lot more safety works. We also did 765 welfare checks of all of our clients. We phoned each of them up to make sure they're okay and they had enough food and prescriptions and things like that. And while we were there, we found there was a lot of unmet need going on. So still a lot of people who needed help, but we couldn't help. So we've tried to change those things. So next slide, please. So why dementia? So basically, we always have helped with dementia. We used to do it with our disabled facility grants, but after about a year or so of running safe and secure grants, we found that they were very, very popular and well used by health professionals, and we were often asked to fund small things for dementia in a very sort of ad hoc way, and we wanted to do something a bit more organised. And we sort of talked to other people that had sort of set up a dementia scheme, and what we didn't want to do is set up a pilot. A lot of areas seemed to set up a pilot, and then obviously when the funding dried up, that scheme stopped, and we didn't want that to happen. So we wanted something that was actually embedded within our service that we could carry on. So what we did is we amended the Safe and Secure grant, which we already had in our policy, and made sure that that could be used for the dementia offering. Next slide, please. So as Yasmin said, we have all had dementia training, but we're not dementia experts. So what we did is we partnered up with our local service, which is Dementia Oxfordshire, and they work with people that have had a diagnosis of dementia and they get referred to them by their GP. And we spoke to them and clients of people who had dementia to find out what actual interventions they wanted. So what sort of things would be useful for them. So some things are funded by Minor Works, and there are a lot of smaller items that aren't. So we worked with them and set up a referral form for them to send through to us. So they can request these items on a form, discuss it with the client, and then we will deliver it and install it within 3 to 5 working days. Yeah, that's the next slide, please. So since the launch of that, we've done 142 dementia measures. And again, the average cost is very small. They're not huge interventions, but they make a huge difference to people's lives. So you can see there, the average cost is £86.45. But 39 of those cases were also then referred back to the Home Improvement Agency for other work, so gas safety work, repairs or adaptations. And many of those clients haven't been able to engage with support services before, so it's the first time we go in, deliver an item, and then they're able to then trust us. And then you can see that quote from somebody there who's just said what a difference that small intervention has made to them and their family. So keep going to the next one. So these are some of the measures that we actually give out. So you can see there's a big button telephone there, there's the calendar, there's a key safe, signage, which I think was already mentioned. We do laminated signs. They're very, very simple. They don't cost very much, £1 or £2 for each one. But it can make a huge difference to somebody to say, this is the toilet, this is the bathroom, this is your kitchen. And you can also put individual signs on people's cupboards if that's what they want. The curtain to the right hand side there, it has two effects really. It obviously keeps the person warm, helps with energy efficiency, but also, as Rebecca was mentioning earlier, the fact that the door is covered over means that very often for a lot of people it's not there. So it could be that somebody has a problem with going outside all the time and they see the door and that becomes a distraction. Also, they can worry about the door, so just covering it over effectively makes it disappear, so they don't worry about it so much. So it has a dual aspect. We've also got the different colour toilet seats, toilet roll holders, and then at the bottom there we've got a whiteboard, and that's a very simple intervention where carers can put messages on there to say, don't worry, I've just gone to the shops, I'll be back at 1 o'clock, or your carer's coming in at this afternoon to give you your lunch, or whatever message they want to put, whatever's useful for them. And then we've got heating controls at the bottom as well. And as I said, they can use a form to request any of those measures. We go on to the next one. So we also designed this tick list, and then the dementia advisors can go through this with a client in their own home and decide with them what is going to be the most suitable thing that would help them. So it's the client and their carer can decide what would work for them, what they find useful, and then they get left with this list, which is a visual representation of what they've agreed to have in their home. So it just allows them to remember what they've asked for and see a picture of it as well, so they can visualize it. And it just reduces a bit of the worry about us coming in and what we're actually going to be doing when we turn up. We also have another thing at the bottom of the form which asks them sort of safety issues, so that they aren't actually limited to just these things. They can say, and they need this specific thing. This is just a list of the main things that we get asked for. And we also ask them about heating and safety issues and repairs and things. The next slide. So this is just one of the simple referrals that we got from Dementia Oxfordshire. So initially it was just a request for a memory clock and a visit from the Home Improvement Agency as the house was a bit cluttered. So when we went out there, the caseworker identified that the person had no heating, they had no hot water, they had exposed electrics and a huge hole in the kitchen, which was due to damp rot. So it wasn't just the memory clock that was the problem. So in this example, we delivered the whiteboard and the memory clock, which the person asked for when we were there, free of charge. We took round temporary heating and a warm pack, and then arranged a free boiler service and repair. So clients got heating and hot water now. We arranged a free safety check, sorted out the subsequent electrical works. We helped the client to remove some of the clutter, and we completed the damp rot works. So if you click it again, there should be a quote from the client. So it's just made a huge difference to that person. And the important thing to mention is this happens all the time. So very often we get asked just to do one small intervention, take around a clock or a whiteboard or something like that. but there's very often a multiple of other issues that that person hasn't mentioned to anybody, and they might have multiple agencies working with them. But when we can go, we give them the item, and then they can give the confidence to actually talk to us about the other issues, and we can help them sort those out too. Next slide. So I'm not going to read those out, but that's just some of the comments that we've had from either our clients or one of the workers that we work with, just thanking them and saying what a difference it's made. And as I mentioned earlier, the average cost of these items are £86, so they're not huge items that we're giving out here. It's not huge amounts of money, it's quite small, but for them it's making a huge difference and picking up other issues as well. Next slide. So as Yasmin's already mentioned, during the pandemic, an article came out, I think it's the Centre for Ageing Better, and the article was talking about loneliness and people with dementia, and it was saying that music interventions had a really positive effect on people's moods and depression and emotion things. A lot of people living on their own with dementia. So we talked to Dementia Oxfordshire, and they suggested that the best thing was these big button radios, which are basically radios, and they just have one big button on them basically. So the person can decide what their favourite radio station is. We can set it to them, and then they can just push that button and it can have music and people talking to them, which makes them feel a lot less lonely and a lot less isolated. Next slide, please. So we thought, why stop there? We've got this Safe and Secure grant. We've been working really well with dementia. Why don't we also try and tackle some of the other Better Care Fund aims? So we also started working with the falls prevention team, and we created a referral form for them in a very similar way, so they could just have a tick list of things that they thought would stop that particular person falling within the home. They can refer it through to us, and then we'll immediately go around and deliver and install those things. It says that we will do it within 3 to 5 days with the dementia, by the way, but generally we tend to go around the same day because we have a lot of the equipment in stock already, so we can take it straight out. Next slide. So also we've recently had training from ThinkCO about carbon monoxide risks. So we've also now offered free carbon monoxide alarms to vulnerable owner occupiers, and we've included that on both our falls prevention and our dementia referral form, so we can give those free of charge to people as well. So we started giving those out, and we're also going to try and do it with our all our other disabled facility grants and handy person checks as well, to make sure that everybody's got one of those that need them. Now, hopefully, the next slide. This is a video, so hopefully if we can get this working. This is one of our clients talking about what difference it made to them.
Well, we first came in contact with the Home Improvement Agency when they were part of the Dementia Awareness Day that was staged a couple of months ago. And attending that, we've got lots of information about different ways in which somebody who is experiencing dementia can have as good a life as possible. And I was lucky enough to be able to spend a moment or two with Michelle, who explained how the service operated and how they could help us live better.
And I phoned her when we got home, made an appointment. She came and did an assessment, stayed for an hour or so here, but also she came bringing Pat with her. And the two of them, when they come into the house, and they've been a few times now, I personally feel, and I'm sure Des would agree, that two very caring friends coming to actually help you in the house. Smiles, friendly, understanding, sympathetic, empathetic, and more importantly, they are a few steps ahead of you.
Well, it was really a tremendous step forward, actually, because for a while now, I've been less capable of doing the home improvement work on our house that we needed to do. That lots of little jobs were building up, but I'm not as well as I used to be. And it was great having a real expert come and fix things in one run. And the Home Improvement Agency really set to the task of making our home easier to live in, given my dementia condition.
There was a really nice bit. They did another little video for us, and they were saying that they were advised to put risers on their sofa, but they said that the ones that have been suggested just wouldn't work for them particularly. So they really appreciated the fact that Michelle and Pat, our handy person, went round and discussed it with them and said, you know, what would work for you? What's the best thing that would be work? And listened to them, and then actually fitted what they needed. So that made a huge, big difference. So I think that's the end of our presentation. So it's just if anybody wanted to ask any questions, and I think the last slide's got my contact details as well, if anybody wants to email me afterwards.
Thank you, Becky. I do feel there's a theme emerging here, and some people have picked up on it. There's the person-centered stuff, but also the importance of casework here, and the importance of actually unpacking this time that you need to spend with people, just to see what their priorities are, just how they are experiencing their home, their condition, the choices they want to make. And the only way you can do that, as you just said, is to sit down with people and have that conversation. And it is resource intensive. People have made that point. It is there's a price to be paid for that. But I think it's not as big a price as having somebody end up in residential care or actually care arrangements, no matter how informal, breaking down. So thank you. Any questions? So if you've got to pop them in the chat, I'll pick them up. John Adams said that they used to do something like this where he was. I'm not sure where he is, but I wondered what made us stop. I do feel sometimes that we're that we're repeating ourselves. Less money in the system from 2008 has meant that some of these services became much more difficult to deliver. Becky in Oxford is obviously finding ways to use the local housing assistance policy to provide some of these services anew. And really that's the position of us at Foundations, that we want to encourage local authorities to explore to the maximum the discretion they have in delivering a range of services for a range of people. Is there any questions?
But you can notice on the presentation, it's not a huge amount of money. It's tiny amounts of money. The amount of money that they want, and just to be able to keep themselves safe and stop them going into care is tiny. I think that's waste of money not spending it.
I think that's such a good point. For so long, practitioners in the sector became gatekeepers to a budget. But actually, when you're living with dementia, I don't think you're there to strip the system bare of resource. You really have more important fish to fry. And as you say, what you want is to make the house work for you. And very often, those are very small interventions. A very early pilot that was done by Worcestershire suggested that actually, if you made a non-recessed grant available to everybody on the cognitive impairment pathway, in other words, diagnostic pathway to dementia, the average grant was £135, which is a tiny amount of money. It was spent on clocks and lights. Joanne Rodwell, you've put funding with big letters in the chat. Yes, my daughter would say that you put F in the chat. I'm not sure that funding in the current climate is that big an issue. The DFG has risen year on, year out. There are large areas where the DFG is underspent now. I don't think Becky's is one of those, but then she has got a very generous private sector housing policy. I don't think it's always about funding. It is about actually exploiting the discretion that you have at your fingertips as creatively as